Dr. Dina Kulik has had a lot of conversation about measles ever since Toronto Public Health confirmed an outbreak of the illness in the city.
Every single kid I've seen in the last 2 days, the parents have come in asking me questions about whether they should be getting vaccinated, how to prevent illness, what are the warning signs. Lots of concern.
12-month-old Adrian is due for the measles, mumps, rubella vaccine, but his mother is on the fence.
I would just like to get more information on how accurate that stuff is and if there's a possibility of him having any neurological issues because of it.
Thousands of studies over the last 10-15 years have shown that not to be the case, and yet the myth still persists.
Health officials now find themselves advocating for vaccinations after a growing anti-vaccine campaign, including the province's health minister, who did his PhD in measles vaccination. Eric Hoskins says a 100% vaccination rate is ideal, but may not be necessary.
Get the vaccination rate in the community high enough so it creates what's called herd immunity. So when that virus is looking for a vulnerable host or a vulnerable person, it just makes it harder to find that person.
Measles is highly infectious. The virus can live on surfaces for as long as a couple of hours. Toronto Public Health says there are no links to connect the 4 confirmed cases of measles, so the search for the source will be challenging. Doctors say that will make it tough to prevent more cases.
And I could be walking by you in the street, cough, you won't even notice it, or I could be talking or laughing, sputum can come out, infect the air, you can breathe that in.
And Dr. Kulik adds a worst-case scenario here. She's telling her patients about, and that is roughly 1 in 1,000 kids who get measles will develop an infection of the brain that could cause seizures and even death in some cases.
So how long will someone be contagious before the symptoms show up, Maribel?
This is where the concerning part of the whole argument is that before those telltale red rashes and dots show up, someone could be contagious 4 to 5 days before becoming obviously infected. And so this is what has healthcare providers really worried, is how many people are now walking around out there who might be infected now.
Yeah, thank you for that, Maribel.
You're welcome.
We have more on this for you now. The resurgence of the virus in the U.S. also heated up the vaccination debate south of the border. Hillary Clinton added her voice last night. She likened denying the power of vaccines to questioning whether the earth is round. Meanwhile, a story once published by author Roald Dahl is being widely recirculated. It's a plea he wrote in 1988 to urge everyone to get their kids vaccinated, and details how he lost his daughter to the virus in the 60s.